Good afternoon, everyone. Thanks for joining us. It's 2 o'clock and time to begin today's briefing. Our featured speakers today are Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Office of Emergency Management, Marlena Jackson, Interim Commissioner of the Milwaukee Health Department, Claire Woodall-Vogue, Executive Director of the Milwaukee Election Commission, Milwaukee County Clerk George Christensen, and Julietta Henry, Director of the Milwaukee County Election Commission. County Executive Crowley, you're starting us off today.
Thank you so much, Sydney. I want to start by mentioning the high levels of testing we saw throughout Milwaukee County yesterday. Throughout the pandemic, there's been a high demand for COVID testing on Mondays, and yesterday was definitely no exception. The Miller Park testing site, which can accommodate 2,000 tests per day, yesterday exceeded that number by more than 300 tests. Unfortunately, a number of people were turned away. Additionally, the two testing sites operated by the city were also at or near capacity yesterday. The Northwest Health Center conducted 462 tests. The South Side conducted 340 tests. These numbers show that we're seeing a surge in testing, and we understand that it's frustrating to be turned away from a testing site, but please know that we share your frustration. And staff at the testing sites are working very hard to ensure we're able to provide tests to those who need them. Thankfully, though, there are a number of options for testing in our area. So be sure to visit testupmke.com for more information, for updates and support related to COVID-19 testing. Though we're seeing a surge in testing, remember that it is not a substitute for prevention, but there are things that we can do to prevent the spread of COVID-19. And those protective measures include the 3 W's: wear a mask, wash your hands, and watch your distance. And make sure to keep your physical distance at least 6 feet between yourself and those outside of your home. And we want to, continue to recommend folks to, refrain from gathering in groups and stay out of crowded places and avoid mass gatherings. And use alcohol-based hand sanitizer, if hand washing isn't readily available. And again, always wear a mask or a face cloth covering outside of your home. And so when it comes down to the prevention, we also need to consider the impact of small family gatherings on the spread of COVID-19. And while we all know that large gatherings can increase the spread of COVID-19, small gatherings can too. And so, we have to be conscious of those Packer parties, of holiday gatherings and birthday parties, which can also create higher risk, which also are created higher risk activities. And so, consider the risk before hosting or attending some of these small parties and ask ahead of time as far as who's going to be attending, how many people, and is this going to be indoors or outdoors. But protective measures need to be in place. And I would, say we should ask that as well. And so the more that we can do to limit the spread right now, the healthier we'll become in the long run. And finally, the last thing I want to touch on is that Election Day is just 1 week from today, on November 3rd. So if you're voting absentee, your ballot must be received by Election Day. And so this means that today is the last day recommended that you put your absentee in the mail. And if you're going to, and if you have your absentee ballot, mail it in today or drop it off at your municipal clerk's office or at a ballot drop box. And so with that, I'll turn it over to Mayor Barrett.
Well, thank you very much, Mr. County Executive, and thank you again for working so closely with the city on these issues. When we first started seeing the pandemic back in March, April, even through June, and I looked at the numbers throughout the nation, I was quite honestly heartened by the fact that on a per capita basis, that Wisconsin was faring very, very well. When you looked at the number of cases we had through the summertime, it was looking pretty good. Again, nothing is good about this pandemic, but if you looked at what was going on first in the eastern states and then in the southern states and western states, we're faring very, very well. Unfortunately, that has changed dramatically over the last month. And I don't think there should be anybody who's watching this who should be under the mistaken notion that somehow we are turning the corner on this disease. In fact, here in Wisconsin, exactly the opposite is taking place. It is worse now than it has ever been before. In fact, just prior to this call, I was looking at where Wisconsin ranked now. And over the life of this pandemic, we unfortunately have now risen to number 8. And at one point, we were probably in the 30s in terms of per capita cases. We are now number 8 all time for where we are in terms of per capita cases. That, even more bad news, is driven by the fact that over the last 7 days, for example, we are number 2 behind Texas in the number of cases. And on a per capita basis, we're probably number 3 behind the Dakotas. And so we are in a situation in the state of Wisconsin that is dire when it comes to COVID-19. Unfortunately, the response has been a very divided response coming out of our state government. Somehow, this COVID crisis has not fit into the schedule of the Wisconsin legislature, and they haven't met since basically March or April to deal with it. And during this period, what we have seen are lawsuits, what we have seen are increasing cases, what we are seeing is economic devastation. And yet we have a divided approach because it has become so political. This should not be a political issue. This is a public health crisis, and it requires a unified response. There's plenty of time for politics in politics. It doesn't and shouldn't and must not be in the area of public health. And you need to only look at the indicators, because last week we saw 2 of our key indicators turn to red, a sign that we are quickly moving in the wrong direction on this pandemic. That's why yesterday the health department released adjustments to our Moving Milwaukee Forward safety order that were made in order to help reduce the spread of COVID-19 in our city. Commissioner Marlena Jackson is with us today, and she'll talk about those updates in greater detail. The county executive did a good job touching on the testing as to where we are right now. As he mentioned, at Miller Park, we had over 2,300 people yesterday, and that's more than the capacity that we have. On the northwest side, we had 462. The south side, we had 340. So we tested well over 3,000 people yesterday, but that tells you that the demand for testing is growing as well. But we're going to continue to work as the National Guard hands over the responsibilities to our local health department employees to make sure that that can continue. But again, bear in mind here that this is a plan that we can project only through the end of the year because it's going to require additional funding from the state or the federal government if we're going to go beyond that. All this, of course, is a lead into what's going on right now in terms of our democracy in the election. I think we're all probably happily now recognizing we're in the home stretch and are only 1 week away from the election. That's why we've invited Claire Woodall-Vog, who's the executive director of the City of Milwaukee Election Commission, to brief us all today on that. She and her team have been working tirelessly, and I mean tirelessly, around the clock to ensure that this election is safe, secure, transparent, and accurate. We focus on integrity and making sure people can have their right to vote. So I'd like to acknowledge the tremendous work of the election administration team and the dedication of hundreds and soon to be thousands of poll workers and volunteers who are ensuring a safe and secure voting experience for all of them, for all of our voters. Thanks to the heroic, and I mean heroic because they're going out in the public at a time when we probably would prefer not to. But they are really doing the job because a record number of voters will be participating in the 2020 general election, despite the challenges of the COVID-19 pandemic. Finally, I think we also have to recognize where we are in this process, this democratic process. Late yesterday afternoon, the United States Supreme Court denied an appeal on extended time for people to submit their absentee ballots. People who have absentee ballots at home should recognize this. This is the time to return your absentee ballot if you're going to use the mail. We do not want a single vote that is not counted because it arrived after November 3rd. So if you are planning to use the mail to return your absentee ballot, do it today. Get it in the mail today. We still have the drop boxes. We have 15 drop boxes, and as Claire can talk about, we've already updated that even more secure. These were the original drop boxes that we had ordered from Oregon, and we feel that they are the state of the art and the most secure drop boxes that are being produced. So again, please make sure that you have an early voting plan. If you're going to use the mails, put it in the mail today to ensure that your ballots will be counted. Otherwise, come to one of our early voting locations or use one of our drop boxes or come on November 3rd. So with that, I'm going to turn it over to Dr. Weston. Doctor?
Thank you, Mr. Mayor. Good afternoon. First to our numbers, we've had 39,986 confirmed cases of COVID-19 in our community and 476 individuals who have died. In Milwaukee County and in the state, there's very little positive news to report. As the mayor mentioned, Wisconsin is now the third worst state in the country in cases of COVID per capita, behind only the Dakotas. We continue to see hospitalizations of COVID positive patients rising sharply without any apparent slowing or flattening of the curve. In the county, we have over 300 hospitalized COVID patients, much higher than we've seen at any other point in the pandemic. On a perhaps positive note, we are seeing individuals taking the initiative to get tested, with higher testing numbers also than we've seen at any point in the pandemic. We do continue to have overall testing capacity. That's both at our public health testing sites. So that's Miller Park, that's the Northwest and South City sites, as well as our South Shore site in South Milwaukee. But in addition, you can go to Test Up MKE or call your healthcare provider or call 211. There's definitely capacity in our 16 health system associated testing sites as well. So lots of testing options out there, and we continue to work on expanding testing to areas of our county in need, those areas that have high rates of COVID without as much testing ongoing right now. Next, with early in-person voting ongoing now throughout Wisconsin, and for those not able to vote early, for Election Day next week, the safety of in-person voting is clearly on many minds. There's a few key recommendations that you can follow to be as safe as possible. First, and most fundamentally, follow the same precautions that we've been talking about for any other activity during COVID. That is, wear a mask, keep your distance from others to at least 6 feet, and wash your hands before and after entering and leaving the polling locations. Second, vote in a way to minimize your contact with others. So Wisconsin has early in-person voting. There are a lot of great voting information websites. You can also just Google your community and early voting, and you can find out how to do that. You can avoid the lines. You can go vote today while still ensuring that you're able to vote in person if that's what you want to do. Third, whenever you do vote, try to vote at times when less people are there, times like mid-morning. And be prepared with your picture ID, if you need to register whatever documents you need, and maybe bring your own pen along as well. So those are 3 key items you can do to ensure you can vote safely in person. And there's a lot of ways to vote and clear guidelines on how to do so safely. Overall, please continue to be vigilant and to be cautious as we work through this spike in cases and hospitalizations in our community. Use every layer of protection available, masking, distancing, and being out in open air. And seek out testing from one of the many testing locations available. If you have symptoms, if you have close contact with someone who tested positive, or if you're referred by a healthcare or public health practitioner. Thank you very much. Stay safe, and I'll pass it along to Interim Commissioner Jackson.
Thank you, Dr. Weston. Hello, everyone. So I am going to share with you the major updates for the Moving Milwaukee Forward Safely Order 4.2. We've learned a lot about this disease since our first order back in June. And one of the things, and so there's been a lot of change, obviously, changes in our order, changes in how we understand the disease process and spread. But one of the things that has not changed is our goal to save lives and to slow the spread. We know in the city of Milwaukee that having orders around mitigation and masks have helped to save lives, and to some extent explains the difference between the positive case rate in the city of Milwaukee as it compares to other jurisdictions. Because COVID-19 can be asymptomatic in some individuals, it reduces our ability to always say with 100% certainty that spread is or is not occurring in a particular sector. However, there is no denying that cases are up in a statistically significant way, and that COVID continues to pose a threat to the health and well-being of the general public. This order 4.2 is not meant to be punitive. We absolutely understand the impact that the decisions we make have on individuals, have on families, and have on businesses. Our hope is that by updating this order, we get to a place where we can be fully open again, but we have to get there safely. And to get there, we have to watch our numbers, we watch our gating criteria, we embrace the best advice of our public health experts, and we follow the science. With that, I'm gonna give you the 5 major updates to the Moving Milwaukee Forward Safely. First of all, our public gathering limits will be reduced to 25% of a site's capacity, or 1 person per 30 square feet, or 10 people, whichever is less. So based on your particular space, you have to calculate your 25% capacity, your 1 person per 30 square feet, and then the number 10. And out of those 3 numbers, whichever is less is what is required in a public gathering. Additionally, seating is now required, with some exceptions to that. But the maximum order for outdoor spaces is 25%. This particular gathering limit guideline affects places of amusement, it affects theaters and conference centers, to give examples. Religious and political events are also subject to gathering limits of 100 people, and they are also required to be seated. For those restaurants and bars that do not have an approved City of Milwaukee safety plan, your occupancy is now restricted to 25%, which is down from 50%. All dance floors are prohibited moving forward, and all patrons must be seated except for when arriving, departing, and walking to restrooms. Additionally, the City Health Department has eliminated the warning or education step in our enforcement process, and we will be going straight to citations. This is important to note because this order goes into effect Thursday at 12:01 a.m. And so as the weekend approaches with holidays, it's important to note that we will, as a health department, continue to enforce without that middle step. Also regarding team sports within the City of Milwaukee. So team sports, whether they are in schools or individual clubs, are restricted to only intra-team or inter-school events, unless there is a safety plan that is approved by the City of Milwaukee. To complete a safety plan, you must know that each safety plan that will be approved, there is a minimum testing requirement, which would be 3 tests per week, at least once every 3 days for each individual player. The individual school or club will be responsible for that testing expense. If a plan has been previously submitted to the Milwaukee Health Department, it must be resubmitted with the details related to their new testing procedures. The last major change is regarding the City of Milwaukee schools. And just to share that we continue to require that COVID safety plans be submitted to the health department, but moving between the instructional models, so hybrid, virtual, or all in person, will be made based on the school's individual disease burden versus the community burden as a whole. And that's obviously with the direction of the health department staff. So overall, we will continue to work to be transparent with you all as we move through our phases, as we update orders. The full order is available online, and I would encourage you all to go and have a look at it to see how it applies to your particular space. And it would be at the Milwaukee Health Department website. And I believe that overall, those are the updates. And we just have to remember, again, this is not punitive. This is to protect individuals. It is to save lives. And we have to do it together as a community. Thank you so much. I will now turn it over to Claire.
Good afternoon, everyone. The Milwaukee Election Commission is very pleased to announce that over half of our registered voters as of just a few minutes ago with our early voting numbers, have already requested or voted an absentee ballot. This means that we are doing a very good job of getting the word out about the safest ways to vote as we go into the last week's stretch before Election Day. We have already had over 32,000 early voters in a matter of 8 days, and we're on track to beat the records of 2016's early voting numbers. We have seen a decrease in our lines and an increase in social distancing since the first day began, and are really seeing record turnout, what we believe will end up being record turnout for early voting. 120,000 of our nearly 155,000 ballots that have been issued have already been mailed. So if you are one of the 35,000 voters still holding on to your absentee ballot, we would strongly encourage you to go ahead, don't delay, and drop it off today. Today is the last day that the city of Milwaukee would recommend that a voter mail their ballot back to us. As of last night, the Supreme Court decision was final, and all ballots have to be received by our office by 8 p.m. next Tuesday. We do have 15 drop boxes set up across the city, and we are seeing many voters utilize these drop boxes as a safe alternative to returning their ballot via mail. Once a voter drops it off at the drop box, they can go onto myvote.wi.gov and confirm that we received their ballot within 24 hours so that they can have peace of mind and know going into next Tuesday that their ballot will be counted. In order to get updated statistics each day as we get closer and closer to November 3rd, voters and media can go to our 414 Votes website. It's milwaukee.gov/414votes and see updated statistics on early voting, as well as our absentee ballot return rates. These are updated each day, and it also shows our number of registered voters. As we get closer to Election Day, and we are seeing a rise in our COVID-19 numbers in our community, we want voters to know that we are prepared. We have recruited and trained over 3,500 election workers to staff our polling places next Tuesday. We'll have 173 locations open, and many of our volunteers who have signed up to work are younger and at a lower risk for COVID-19 and have really taken this on as a civic duty, recognizing that they will be putting their health on the line a little bit, but recognizing that this is a frontline, essential function of our democracy, and we are extremely grateful to them. So again, voters should be remembered to bring their masks, to practice social distancing, to wash their hands before and after voting, and to have patience as they go into Election Day. Like I said, we have seen over 50% of our voters already vote or request an absentee ballot. So we are hoping that this will alleviate any congestion that we would typically see in a presidential election, and instead ensure that we have a safe voting experience no matter which way you choose to cast your ballot next Tuesday. And with that, I will hand it over to our county clerk, George Christensen.
Thank you, Claire, good afternoon. So obviously, a lot's been said already, and I don't want to belabor issues, but I do want to point out that it's just important for the media and the public to understand that the logistics of election night reporting here in Milwaukee are different than most communities across the state due to our size. We have, of course, several of the largest municipalities in the state, including Milwaukee, of course, West Allis, Tosa, Greenfield, Franklin, Oak Creek, et cetera. Claire had mentioned patience, and we live in this environment where everyone wants instant gratification, and they want to know the results immediately. But while we do have the latest and most secure election technology available, elections are about getting things right, not getting things fast. And I think that's important. Certainly conducting a presidential election is difficult every 4 years, but doing it in the middle of a pandemic certainly is a challenge. However, we're ready. And I think people need to know that. As Claire mentioned, and municipalities across Milwaukee County have been preparing for this moment. So with this third wave of COVID hitting our state, we know how vital it is to protect voters, to protect poll workers, and also make sure that their voices and their vote is heard on election day. Our goal has been to allow voters to vote their way. And that can be, again, returning your absentee ballot by mail or a drop box, or dropping it off your municipal clerk's office, in-person absentee voting, or going to the polls on election day to vote in person. Claire had mentioned that some of the deadlines, and we would direct you to the myvote.wi.gov for that. With respect to COVID, the preparations that have been taking place across Milwaukee County have been monumental. With the assistance of the Wisconsin Elections Commission, we distributed over 100,000 of personal protective equipment, PPEs, everything, quite honestly, that you could think of, whether it be 2,000 rolls of toilet paper, for example, 25,000 masks, 3,500 bottles for a hand sanitizer, 75,000 pens. We've tried to think of absolutely everything. But despite all of this, we are counting on the voters to be safe out there, to wear your masks, please, and to be safe and be respectful and understanding of your poll workers and your fellow voters. Everyone is working hard to try to make sure this election is run very smoothly. As the mayor had mentioned, we're so fortunate to have just incredible, dedicated public servants working with us and for us. And I would be remiss if I didn't mention Julietta Henry, my election director, who has just been working tirelessly with her staff. It has been unbelievable, the amount of work that the County Election Commission has done. And with that, I will turn it over to Julietta to give you additional information. Julietta.
Thank you, George. Well, as of today, we know in Milwaukee County, we have received over 296,000 absentee ballots have been issued, and we have received 235 of them have been returned, of which we know countywide, there were 55,000 people who voted in person, and that is a part of that number. So we're pleased to say over 79% of ballots issued have been returned. We are encouraging individuals to take your ballot today, drop it off at your municipal clerk's office, or they have the drop boxes throughout the county. If you place it in the mail, do check on myvote.wi.gov to verify that your ballot was received. It is imperative to note, if it was not received, you will not be able to vote on election day. So make sure that you follow the instructions and have your ballot. And I would just, at this late date, because it can take up to 7 days for that ballot to return via U.S. Postal Service, I would just take my ballot directly to my clerk's office. All municipalities, with the exception of the city of Milwaukee, will be open until 5 p.m. on Friday for in-person voting, in-person absentee voting. If you have not registered, you have until 5 o'clock on Friday to register to vote. However, you may also register on the day of the election at your polling location. The city of Milwaukee will be offering in-person absentee voting service throughout Sunday, November 1st. Please contact your municipal clerk's office for times and location for in-person absentee voting. Reminder about turning the ballots, as I stated, you have until 8 o'clock on Tuesday for your ballot to be returned to your clerk's office. And you should double check again, myvote.wi.gov, to find out where to vote. Some of the polling locations have changed throughout the year because of COVID. Also, you can track your ballot there, find your polling site, find what's on your ballot. So you should do all of that before election day if you plan on voting on election day. We are experiencing a shortage in poll workers in some of our locations outside of the city of Milwaukee. So we are encouraging individuals, if you are interested in working at the polls, please call our office today at 414-278-VOTE. That's 414-278-VOTE. On election day, as a result of all of the absentee ballots that are being issued, as well as having to be counted, it is going to be a very long night. We ask that you be patient with the Election Commission office as the county, the results are sent into the county. We are anticipating a closing time between 3 a.m. and 6 o'clock a.m. on Wednesday. So we just ask for your patience as we process every ballot, because as you know, every vote counts. Thank you, George.
George, you're on mute.
My apologies. Thank you, Juliet. And just to emphasize what you just said, we're really asking the media to help us convey that message to the public, to understand it does take extra time when you're counting these ballots and the results are being reported into the county. And that's a good thing. That's a good thing. It should take time. It's not a cause for concern. It's a sign that democracy is working. And with that, I'll turn it back over. Thank you.
All right, thank you. Any questions? We are starting to see some questions come in. Rose Schmidt from CBS 58. My understanding is that restaurants and bars without approved safety plans were already required to operate at 25% capacity under the governor's and DHS orders. How does 4.2 change that? Was the idea just to solidify the capacity cap in Milwaukee in case DHS's order gets struck down again?
Correct. So the 25%, we moved it down to 25%. The Moving Milwaukee Forward Safely order was originally at 50%. Once the governor's order went into place, that moved it down to 25. And so in our new order, it is now 25 if you don't have a plan in place, an approved plan, excuse me. I'm sorry, and then the question about expecting additional restrictions to come out. As I've shared before, we are going to continue to watch our numbers. We will continue to look at our gating criteria, and we will make those decisions based off of what we see.
Thank you, Commissioner Jackson. Our next question is from Allison Durr at the Milwaukee Journal-Sentinel. Will Milwaukee's new health order affect anything related to the election, including in-person voting or counting of ballots?
So it will not. Those are exempt under the First Amendment, government operations. So no, the order does not affect the process of elections.
I would say, and I certainly concur with the commissioner, I will say once again, as I've said many, many times before, though, it is wholly irresponsible for the state legislature to require us to count these ballots on election day beginning at 7 a.m. From an efficiency standpoint, from a healthcare standpoint, from a transparency standpoint, it is a miscarriage of justice that we are not allowed to count these ballots earlier, where we could do it in a way that would not require us to bring literally hundreds of people together at the same time. It is so wrong on so many different levels.
We have another question from Allison Durr related to the Miller Park testing site. Miller Park was experiencing long lines yesterday. What is being done to alleviate those waits? And when will there be weekend hours there or at the two health centers?
So I can take that. Yes, there were extremely long lines yesterday at Miller Park. Traditionally, Mondays has been the heaviest days that we've noticed throughout testing since it began back with the National Guard. Again, our testing site there at Miller Park is, from a capacity perspective, is able to handle between 1,500 and 2,000 tests. So we were over that yesterday, which from a testing perspective and the amount of tests that are happening in the community is a great thing. We want individuals to be tested. But in regards to obviously what we could handle yesterday, particularly, we did have to close for that temporary time. We're continuing to look at that, and we will be making adjustments as we have throughout this entire pandemic when we see things that need to be improved. We are working on the the weekend hours, and as soon as we have a date for that, we'll make sure to share it. I know it was was already shared earlier on this meeting, but I would encourage individuals to make sure that they are going to the Test Up Milwaukee MKE site, because there are also a number of other opportunities to get testing, both on the weekends and at other sites. So it's not just the Milwaukee Health Department 3 sites. There are a number of other free testing sites available. So please go there, make sure that you know there are other testing sites available. But we will continue to work on our end to make sure our processes are as fluid as possible, and then we'll get you the weekend date as soon as we have it.
And I think what we're seeing here, and this is a reflection of where we are with the pandemic and where unfortunately Wisconsin is and where Milwaukee is now, is that we have actually increased and expanded our capacity to test just over the last 7 days. We have more testing capacity now than we did when we had the 2 National Guard sites, but the demand is also growing at a much higher pace as well.
Our next question, also from Allison Durr. Do you have a sense for how many or what percentage of hospital beds are being used by Milwaukee area residents as opposed to patients from other areas of the state?
Yes, when we look at our hospitalization numbers, which are certainly rising in Milwaukee County, there are obviously isolated cases of individuals from other parts of the state, but the vast majority are individuals in our region where we see increasing levels of COVID and increasing need for hospitalizations.
And one more from Allison Durr. Are there any conversations among municipalities in the county about implementing a uniform COVID order across communities again, given the rise in cases?
So our county health officers meet multiple times during the week to have discussions around what we think the best practices and guidances are. So I can't speak for those other municipalities in regards to an actual order, but what I can say is that their guidance that they will be sharing soon, we're trying our best to make sure that we are consistent and similar in what we are directing.
Our next question comes from Caroline Reinwald at WISN. Mayor Barrett or Commissioner Jackson, the new pandemic order appears to only force restaurants, bars, and public sites to drop down to 25% if they don't have a plan approved with the city. How many restaurants and bars does this order actually impact? How many do not have plans approved by the city? Should we expect additional restrictions?
So currently, right now, we have 552 plans approved, safety plans approved for restaurants. There have been 976 plans submitted. And so we are what we're working through is 424. And so what that means is those plans have been received, reviewed, and we are reaching out to those particular restaurants or bars for clarifications or different directives that we might need to give in regards to safety. So we definitely are working with restaurants and bars, and we've continued, I think, throughout this entire pandemic to be as transparent and as communicative as possible with the stakeholders involved. And so we will continue to do that.
Our next question is from Sari Lusk at the Milwaukee Business Journal. The restaurant and bar program is reaching other types of operations, including event venues and caterers. The city of Milwaukee has pointed to gatherings, restaurants, and bars as the main causes of COVID-19 spread. That was reflected in the newest restrictions. With that established, what impact would you say the program has had on combating spread here, given it enables greater capacity in those environments?
Well, I think we overall, the plans are providing much more safety measures than what we would see for just general capacity or no plans at all. So we know that there are absolutely restaurants and bars and other areas too that have really worked hard and to make sure that their customers and that their staff are safe. We also know that there are a number of bars and restaurants that continue to act recklessly, to be very honest, and allow patrons to be in their spaces without masks, to not social distance. And so to the extent that we can in our order, decrease that congregation and decrease that gathering, that we will do that.
One additional question from Sari Lusk. Please clarify, are businesses that submitted plans that have not yet been approved subject to the 25% limit?
Correct. If you have not submitted a plan and you do not have an approved plan by the Milwaukee Health Department, which again is the 552 individual plans have been approved. If you are not a part of that 552, you have to operate at 25% capacity until your plan is approved.
Our next question is from Caroline Reinwald at WISN. Mayor Barrett, Commissioner Jackson, and Dr. Weston. Governor Evers and many other health departments have reported contact tracing is in a dire situation because of the high amount of cases of coming in. Can you explain what kind of situation Milwaukee's contact tracing is in? Do we have enough? Is the city hiring more? Is the situation as dire as the rest of the state?
So here in the city of Milwaukee, we are using our same contact tracing standards that we have since the beginning of the pandemic that we know are public safety approved and public safety endorsed, meaning that we are reaching out to the positive cases and then we're also reaching out to those considered close contact. Just based off of the volume alone, and we too, obviously in the state of Milwaukee are experiencing high volumes, but other jurisdictions are finding it very difficult to do that. It is very difficult when you have a health department that is made of one or two contact tracers. We are lucky via the CARES money in the city of Milwaukee to be able to staff up for contact tracers. And so we have done that. And up until this point, our contact tracers, our average is around 4 days to get cases from WEDS into contact. And with our increased cases over the last 3 weeks, we are seeing about an additional delay, so additional 1 day. Meaning that it's taken us about 5 days. So we have definitely seen the volume impact our ability to reach out to people, but not in a critical way that is stopping our operations.
And unfortunately, we have the history here of being hit first with the pandemic. And I would say that we had our challenges early on in making sure that we had enough people who were doing the tracing. We worked with the Milwaukee Public Schools. We worked with our library. Over the course of the summer, we were able to develop and expand our team of individuals who would do the tracing. And now that we're in the fall, we've been able to continue that stabilized approach. But it has been difficult. It's been difficult for the city of Milwaukee. And so I've watched as other communities, particularly smaller communities outside the city of Milwaukee, whether they're suburban communities, whether they're places like Jefferson County, who have experienced huge challenges in having enough individuals to do the tracing. This will tell you just how quickly and how severe it can hit. And again, we lived through it. We were able to stabilize things. But now, as we see the cases increase, it puts more pressure. But we are not overwhelmed like they are in some parts of the state. That's not to be cocky, because I hope we don't get to the point where we're not overwhelmed. But I can see where it is certainly overwhelming a number of smaller public health departments, as the commissioner said.
Another question from Caroline Reinwald at WISN. Mayor Barrett or Commissioner Jackson. There are local private schools that have important sporting events scheduled this week and this weekend. The games are against other schools and clubs. Will they need to reschedule?
Yes, those games will need to be rescheduled or relocated. They would not be unless those schools are able to submit plans that show testing within that time frame, then they would not be allowed to move forward.
And many of those games involve perhaps a school that's located in the city of Milwaukee and a school that's located outside the city of Milwaukee. And part of the concern, because we've talked about this very issue, is as we see the numbers grow outside the city of Milwaukee at rates higher and faster than they are here, we want to make sure that we are not importing those cases into the city of Milwaukee.
And a question from Rose Schmidt at CBS 58 for Commissioner Jackson. Can you repeat again how many bars and restaurants have not yet submitted safety plans?
So we don't know exactly how many restaurants have not submitted a plan, because first of all, if a restaurant is just takeout only, they do not have to submit a safety plan. So we don't have a solid number of who has not submitted. If we had to estimate, my team is estimating maybe around 200, but we could look into that to get a more accurate number.
We have another question that just came in from Caroline at WISN 12. The new pandemic order says customers must be seated in bars and restaurants and also limits indoor events to 10 people. How are you working with entertainment sites such as bowling alleys, axe bars, game bars, panic rooms, etc.?
So we understand that there are certain spaces where seating is literally just not a logical thing to do. For example, if you're at the Milwaukee Public Museum, that's not where you would go to sit. So we understand that there are situations like that. The seating requirement is really to make sure that we don't have, again, the congregation or gathering of individuals, because we know that it's not just the larger gatherings, it's the small groups of 10 or 15 individuals that we know has spread as well. So we'll continue to work with different businesses and organizations. All they have to do is reach out to us to the Ask COVID MHD email, and we're happy to answer those questions.
Another point of clarification from Sari Lusk, does the estimate of 200 not submitted include bars?
Yes, that's an estimate, including bars.
It looks like those were our final two questions for today. Thanks everyone for joining us. We'll be back here again on Thursday.
Thank you very much.
Thank you.
Thank you.